one of the things that I do regret is how I viewed sleep. I was somebody, and a lot of people with ADHD share this, that I sort of looked at sleep as an inconvenience. I looked at it as this thing that got in the way of me doing other things or socializing with friends and having fun. And I pushed my body in ways that I really shouldn't have. And as a result, your body does very wacky things and your mind does very wacky things.
Welcome to Tilt Parenting, a podcast featuring interviews and conversations aimed at inspiring, informing, and supporting parents raising differently wired kids. Before I introduce my guest and topic today, I have a quick, important announcement, and that's that the doors to my Differently Wired Club are open for new members for this week only. While I know that many of us love learning from podcasts like this and from books and summits, sometimes that extra step, applying and integrating these strategies so we can truly transform our families' lives, can be difficult when we're just so consumed with getting through the day to day. I created the club to help parents do this deep work within a supportive community where we're all working toward the same goals. So if this feels like the kind of support you could use right now, go to tiltparenting.com/club to learn more. Okay, and now on to this week's episode. So I don't know about you, but really, from the time my son was a little guy, sleep has been a major challenge. In fact, the very first type of outside help Darren and I reached out to was a sleep consultant back when Asher was, I think, 1 year old. So I'm excited to be bringing the topic of sleep in differently wired kids to the show for the very first time. Specifically, we'll be looking at sleep challenges in kids with ADHD. My guest is Dr. Roberto Olivardia, a clinical psychologist and lecturer at Harvard Medical School, who specializes in the treatment of ADHD, OCD, and BDD, or body dysmorphic disorder, as well as the associated issues that stem from learning disorders such as anxiety, depression, and sleep dysfunction. Dr. Olivardia is an especially compelling expert on this topic, as he is not only the parent of a child with ADHD, but he himself has an ADHD diagnosis and, in conjunction, has experience with multiple sleep issues, both personally and as a parent. In our conversation, we discuss common sleep problems for children with ADHD, techniques and strategies that are often helpful, the impact of ADHD medication on sleep, and the use of melatonin in children, and much more. And I just want to say that while we focus on ADHD in particular, so many of the sleep challenges we discuss will likely be familiar to all parents. So I hope this conversation leads to healthier sleep habits for you and your families. Hello, Roberto. Welcome to the podcast.
Great being here. Thank you for having me, Debbie.
I'm so excited, and you have so much expertise that is of interest, I think, to my community. So we'll have to bring you back on to talk about many different subjects. But for today, we are going to be talking about sleep. Actually, I've released more than 200 episodes of the show, and I have never covered sleep as its own topic. So I have a lot of questions for you, and I'm really excited to jump in. But can you take a few minutes to just give us a brief introduction about who you are and the work that you do in the world?
Sure. I am a clinical psychologist and a lecturer in the Department of Psychiatry at Harvard Medical School in Boston, Massachusetts. I have a private practice where I treat people of all ages, children, adolescents, adults. I specialize in a couple things. One is ADHD, executive functioning issues. I work with a lot of students with learning disabilities like dyslexia. I also specialize in the treatment of obsessive compulsive disorder. I work with boys and men with eating disorders, which is something I co-wrote a book about many years ago. And also from a personal experience, I have ADHD. I have a son with ADHD and dyslexia. So I come from this particular topic, from both a personal place as well, and do a lot of advocacy work around dyslexia and learning disabilities, and just love to do these kind of podcasts and webinars and presentations to educate people, because as I'm sure you know, that ADHD and learning differences and that whole world is still so misunderstood out there.
Yeah, absolutely. And so Let's just talk about sleep problems kind of in general, because, I've got a 15-year-old and we've had sleep problems since he was a baby. Like, it's just been a part of our life. And so I'd love to even just to start with, is this common for kids with ADHD, and maybe talk about why kids with ADHD might be more prone to having sleep problems?
Absolutely. So I would say I don't know anybody with ADHD, and I know a lot of people with ADHD that does not have some issue or problem with sleep. I mean, to the degree that honestly, it really should be and probably will be at some point a diagnostic criteria. It is so embedded in the neurological wiring for people with ADHD to have problems with sleep, and those problems can manifest in different ways. So for a lot of people with ADHD, and myself included, it can be difficulty falling asleep, sort of just quieting your brain, almost like not attending to all of the noise in your head and just lying in bed. But, as I heard once a quote, which totally resonated with me, that said, for people with ADHD, sleeping is lying in a boring, dark room waiting for nothing to happen. And that's what it feels like. You're like, okay, like what's happening right now? And when you're somebody who's so, ADHD people, our brains are wired to seek stimulation all the time. Like that's how we're oriented, is what is going to stimulate me. And going to bed, you're trying to actually do the opposite. You're trying to de-stimulate. You're trying to come down from stimulation to allow your body to go into slumber and to the phases of sleep. And that's really, really hard. But it could also be issues with waking up multiple times. It could be, even with going to bed and ample sleep, difficulty waking up in the morning. And there's a lot of empirical research that documents this in every culture, different socioeconomic groups, that find that kids with ADHD and adults with ADHD more likely to have sleepwalking, sleep talking, narcolepsy, sleep apnea, sleep paralysis, all of these issues, of which I can tell you from my personal experience, like I am probably the poster child of sleep disorders. I have all of those things. I mean, when I was a kid, as an infant, I had a difficulty falling asleep. I was always a night person. My mother said, I remember her telling me years ago that when I was very young, I would just be up all night. And she said I wasn't colicky, I wasn't irritable, I was just like looking for a party apparently. And I'm the youngest of 3 kids, so she had 2 older kids who she had to be up like during the day for, and she called the pediatrician in exhaustion saying, Roberto he's not sleeping at night. And the doctor said, well, have your older kids kind of stimulate him and play with him all day to keep him up so that he'll just conk out at night. So sure enough, she said she had my brother and sister playing with me all day, and I was up all day and I was up all night. Like I still didn't go to sleep, even with that. If anything, she said I was probably more wired. So it is something that parents can retrospectively look back and say, this isn't something that just started when they were 14. Like I've always kind of seen this. Many people with ADHD also tend to be night owls. And when I actually had a sleep study some years ago, it was validating to me that I have something that a lot of people with ADHD have. It's basically a circadian rhythm disorder called a sleep phase delay in your circadian rhythm. So basically, where most people's brains might start quieting down at 10 o'clock at night, I would actually get this surge of energy. And then it would be about 2 a.m. that my brain would start to be tired. And that is what the sleep study showed. And I thought, oh, okay, this is really interesting. So you see a lot of these kind of issues. Now, of course, if we don't get adequate levels of sleep, because people with ADHD are also more likely, and especially college on, to get less sleep, to be more sleep deprived, which certainly doesn't help anything, and especially is going to exacerbate their ADHD symptoms. So it's a big issue, and sleep requires a level of executive function. So, one of the reasons that we do see it as a problem, particularly for people with ADHD, is, it requires executive planning to say, okay, if I plan to be in bed at 10 o'clock at night, that means everything I have to get done before then. Now, we know people with ADHD, we procrastinate, we put things off for the last minute. And so a lot of times me being up late at night was a necessity because I wasn't getting the work done I was supposed to get done, putting it off, and then I'd be writing papers overnight in college. And so I wasn't getting sleep. So it takes like, how do you quiet the body down and how do you quiet the mind down to sort of get into sleep? But I always tell parents it's really important to understand when your kids are sort of fighting you on it, that some of it, might feel behavioral, but it really does have a neurological underpinning to it. Now, it doesn't mean, and I tell the kids this, it doesn't mean it's like, oh, I have ADD, I can stay up till 2 a.m. We have to work at it because sleep is incredibly necessary for health, but to understand that it does have this biological underpinning to it.
Wow, you just shared so many. I took a bunch of notes and I'm just like, where do I go from here? Because you shared so many interesting things. One, I just want to start with is that I never connected executive functioning with sleep issues. And of course, like that makes absolute sense. We know that most differently wired kids have some deficits with their executive functioning skills. And so, and I think of my kid who was up till 1 a.m. doing the homework that he had 4 days to do and waited to the last minute. And then it just, we've been in this cycle then all week of the sleep deprivation. And then, so that makes total sense. I would love to talk about even just going back, maybe talking about ages a little bit. So I think about the listeners who have kids who are like in preschool or early elementary and are really struggling with their kids being able to turn off their brains at night. And then we read the literature, right? That your 6-year-old's supposed to be getting, 11 hours of sleep a night or whatever that is. And we get advice. I got advice that to use melatonin, like to help. And so I'm wondering, I'd love to hear your thoughts on melatonin and then also just specifically with that age group, what it looks like, because I imagine it changes as they become teens.
Yes. So first is to keep in mind that, from a behavioral perspective, that for an ADHD brain, we need some level of stimulation to almost ground ourselves. And so like when we think about kids who are on the hyperactive side, for example, that hyperactivity is a result of them not getting the proper internal level of stimulation to ground them. So their bodies now are literally moving to search for that kind of stimulation. So now when we're in bed, the lights are off, there's supposedly no sound happening, and we're lying in bed, there's no stimulation. Now, to someone with ADD, that means that your head is easily either your body's going to create that stimulation, so you're going to start moving. And so things like restless leg syndrome, about a quarter of people with ADHD have restless leg syndrome, which are these involuntary movements of the legs that almost feel like these jerks in a sense. But it's really the body's way of almost literally trying to get stimulation, or we're going to create it mentally in our head. So sometimes, for me, it could be something I'm excited about. And then I start activating myself thinking about this, or it could be something I'm anxious about. And now I'm revved up from anxiety and it's even harder to fall asleep. So one suggestion from an environmental perspective is creating some level of stimulation. However, a level of stimulation that is not going to activate them. So for example, having an instrumental song, the same song on repeat at a low volume. So it's something that the kid can hear, but it's not like overstimulating to them, but it's almost like white noise where their brain is recognizing stimulation, which means that they don't have this vast space to be thinking about tomorrow's day at school and all these things. It's like, oh, I'm hearing this piano song, but it's the same song on repeat to the point that it almost gets boring, and then they can easily fall asleep. I keep my bedroom very cold, actually, so that I need weight on me when I'm sleeping. I don't know how people sleep with like just a sheet on them. That's so weird to me. So even in the summer, I have air conditioning in my house, but my bedroom is pretty cold so that when I get in bed, I have the weight of a heavy comforter. And for a lot of kids with ADHD do actually really well with weighted blankets. I tried that. And for me, there's no question I slept more deeply. But for me personally, I felt groggy for hours after I woke up. So it's almost like it made me maybe sleep too deeply. But I have patients who use 15-pound weighted blankets, and it really helps them like fall asleep because it literally is grounding them kind of in the bed. You want to make the bed an inviting place to be in that way. With younger kids, I mean, so I have a son, he's 14, he's in the 9th grade, he has ADHD and dyslexia, and he is his father's son. I mean, there's no question that the genetics are pretty strong. And when he was very young, he had very hard time sleeping. And we bought one of those swings, those, baby swings that you put them in. And I would literally put him in that, and we put it on the highest setting. So for some kids, that would be very overstimulating, where they'd be like crying. There's no way they'd be able to fall asleep with the swing going back and forth and back and forth. For him, that is exactly what he needed. And I didn't care how many batteries I needed to use. That's what got him to sleep, so that my poor wife could get some sleep. And he would fall asleep, and then we'd keep him in there for a little bit, and then I'd take him out, we'd put him in his crib, and he'd fall asleep. And when you have a child with ADHD, you want to keep in mind that, their brain is requiring something different than maybe your other kids who might not have ADHD, that we have to be outside the box. When I would sing lullabies to my son, I didn't sing the typical soft, easy kind of cadence. I sang like rock songs to him and very, loud, like what, again, would totally perturb like my daughter who doesn't have ADHD. Like I sang to her the classic kind of lullabies, but to my son, the louder I sang, the easier he fell asleep. So it might seem paradoxical. Now with melatonin, I always tell people, of course, always check with your pediatrician, never engage in, using anything without talking to your doctor. But studies show it can be very effective, and it even in young people, because part of it is, and I understand, parents, obviously, we always want to be aware and concerned about what, we're giving our children. But I have to stress, there's such an impact of sleep deprivation. It causes so much harm to our body, to our immune system, to our brain. It exacerbates ADHD, anxiety, all of those things that, we always want to make sure that we're weighing it with that. Not to mention for the parent or the caregiver themselves, who, if their child isn't sleeping, it means they're probably not sleeping, and that's not good for their mental health. But melatonin can be very effective because part of it is that the ADHD brain, for a lot of kids with ADHD, it's been shown, melatonin levels are not naturally being released in the ways that they are for neurotypical people who, when the sun goes down, they start to get tired. Again, like I said, it could be this paradoxical effect where they're feeling like a second wind and a burst of energy. And it's almost puzzling, to a parent that doesn't have ADHD. Like I totally understood that because I knew it. I intimately lived that experience. So the melatonin is basically giving the brain something that it almost has like a deficit in. So, but again, always check with your pediatrician in terms of, dosages, because it really varies depending on the person. And just like stimulant medication is not dosed to body weight, which unfortunately some doctors who don't understand ADHD as well still do, because it's all about how it's metabolizing for that particular person. And I know, younger children who are on even ADHD medication who are on higher doses than some adults that I work with because of just the nature of their symptoms and impulsivity and things like that.
We'll be right back after this quick break. During this month of planning and organization for big transitions, rhythms and routines have been absolutely essential for our physical and emotional well-being. So Green Chef nights are reliably and predictably a good night. We know the ingredients will be fresh and prepped, the instructions easy to follow, and the meal delicious. We're all still talking about last week's turkey tacos with mango chimichurri sauce, refried beans, and Monterey Jack cheese. Green Chef contributes to a healthy lifestyle with easy and delicious menus like fresh seasonal salads and grain bowls. And with over 80 weekly meal and market options, plus rotating options to suit a variety of lifestyles, whether Mediterranean, plant-based, calorie-smart, keto, protein-packed, gluten-free, there are always plenty of options to choose from. Whatever you select, you'll get farm-fresh ingredients, organic whole fruits and veggies, and premium proteins, all delivered straight to your door. I love those 4 words, straight to my door. Oh, and one more thing I love about Green Chef, they have an app, which means it's easy to manage meal preferences and delivery from your phone if you want to. And I, for one, want to. I am in that mode where I'm making the most of little moments like waiting in line at the pharmacy or for the F train to pull into the station to tackle all of those to-dos. So the convenience of an app is key for me. Green Chef has a special offer for Tilt listeners. Go to greenchef.com/tilt50 and use code TILT50 to get 50% off plus 20% off your next 2 months. That's 50% off plus 20% off your next 2 months when you use the code TILT50 at greenchef.com/tilt50. Maybe I've watched too many seasons of The Amazing Race, but every time I have to go somewhere on the subway, I treat it like a competition. It's all about making the right gut decisions about which route will get me there the fastest. Sometimes those decisions get me where I'm going early, and other times my gambles don't really pay off. Probiotics can't help with most gut decisions, but if your gut needs a little support, Ritual has your back. Their Synbiotic Plus, a 3-in-1 supplement, has clinically studied prebiotics, probiotics, and a postbiotic to support a balanced gut microbiome. I've been using Synbiotic Plus for about 6 months now, and it's become a core part of my morning routine. I take the mini capsule every morning while making my way through my inbox, whether I'm at home or I'm on the road, because it doesn't need to be refrigerated. And the capsule itself is delayed released, which helps it survive the harsh conditions of the upper GI tract for delivery to the colon, and that's exactly where we want it to go. Ritual invested in a study modeling the human colon, which showed that Synbiotic Plus significantly increased microbial diversity and the growth of beneficial bacteria. There's no more shame in your gut game. Synbiotic Plus and Ritual are here to celebrate, not hide your insides. Get 25% off your first month for a limited time at ritual.com/tilt. Start Ritual or add Synbiotic Plus to your subscription today. That's ritual.com/tilt for 25% off. Yeah, I mean, I'm remembering when my son was younger that we went through maybe 2 years where my husband would they'd wrestle together, before bedtime. Like that was very physical wrestling kind of helped him calm down. And then for years and years and years, probably until he was maybe 12, at least, he would listen to a book on tape. He'd go to sleep to that, but he would be the same book on tape. So because we know reading for him, I used to say, it's like when you read a book, because he's an avid reader, I'm like, that's like watching a movie for another person. It puts me to sleep. It makes him wake up more because it comes to life. But I guess listening to the same story over and over was kind of our equivalent of that dull background noise because it wasn't new every time.
Exactly. So those are wonderful suggestions that, a book on tape that he's very familiar with. So he knows he doesn't have to totally pay attention to it because he knows the details, but he's paying enough attention to it. And, with reading, it's really all of these things are very individual. Like, so for me personally, reading was not one of my favorite activities. And so if I'm going to read something, it has to be interesting and exciting. And if it is interesting and exciting, then it's going to activate me and make it difficult for me to just put the book down and, go to sleep. So reading for me would never work. But there are lots of people with ADD who are like, I'm going to read a chapter and then that helps ground me and calm me down. And so a lot of it, and this is not just for sleep, this is for lots of things with ADHD is, I always say to anyone of any age, like you're really going to be your own researcher and figuring out what's going to work for you. And the benefit, especially when kids are young and you're having these conversations with them, is you're helping them recognize, what is going to work for them and to be mindful of that. And I've always felt that one of sort of the upside of the ADHD experience is that because of all of that I had to navigate, when I was younger and still, it's not like, it's an evolution, but I really know myself really well. Like I know what works and what doesn't because I had to figure those things out in a way. And so I always tell, one advice to talk to your kids about, because it can be tough and it's really frustrating. And especially kids who feel like, why do I always have to work so hard at this and this and this, is to let them know, yes, it is hard work and there's a lot of trial and error. But the result of this is you're going to know yourself and you're going to understand totally what works for you in a way that really could be advantageous later on. But right now it is challenging and it is hard.
It's so true. I always say that these kids do have to work so hard and know themselves so well that they're much more kind of emotionally or emotional intelligence has evolved much more, their self-awareness, than most neurotypical people, because they've never had to really work at it or try to do that deep dive. I'm wondering about some of the strategies, like if you, as many parents have done as I did, are Googling, how do I help my child sleep? And, take a warm bath, try meditation, lower the lights, an hour before. Like, we've tried everything at some point and tried creating new routines, in addition to the things that you've shared. Is it really just individual, or can some of those strategies, like doing a guided meditation or doing some deep breathing or taking a warm bath, can that be helpful?
Absolutely. So all of those things you mentioned are things that I advise people to do. So, when we think of the ADHD experience, is that, we're externally stimulated and externally focused. And so people with ADHD lack what we call an interoceptive awareness, which is really kind of tuning in inside our bodies. And that includes sleep. That includes eating, which is something maybe we could talk about at a later podcast, because I treat a lot of people with ADHD and problems with eating and overeating and impulsive eating. But that same notion of, am I tired? Like, people in my life, who don't have ADHD, and when they're like, you're tired, like, that you're tired. And to me, it's like, well, I don't know what that means. I guess for me, I used to define I'm tired by there's nothing else for me to do, so I should just go to bed. But if there's something for me to do, and when you're in college especially, there's always somebody up, no matter what time of day, then I'm not tired. But that's similar to food, which also, healthy eating also requires a lot of executive function. Like if the food is there and I like it, well, why wouldn't I eat it? Whereas other people would be like, oh, I'm satisfied, so I'm not going to eat that food even though I like it because I don't need it. That's really hard for people with ADHD. We almost have to train ourselves to do that. And with sleep, part of that is setting up the environment. So you mentioned things like dimming the lights. Like I used to not change into my sleeping clothes until literally a second before going into bed. And, what I implemented years ago was 2 to 3 hours beforehand, I change into my sleeping clothes, so that it's almost like you're looking at your body saying, oh, I guess I'm going to sleep soon. Even though you still might not be feeling it, but you're getting like the cues. You're dimming the lights, which is telling, like, I'm somebody, I love lots of bright lights. And so I had to be conscious of that and making sure to dim the lights. For some people, it means getting off of electronics, and that's especially true for kids. I didn't grow up with the internet and all of that. And the kid in me wished I did, but the me now, I'm so glad I didn't, because I would have totally had a problem with it. That the amount of stimulation video games or the internet can give, it can be a lot, to go from that to then nothing, in terms of stimulation. Keeping a room super dark for me helps. No light, and that includes any clocks or anything. Now, some kids have a harder time with that. They'd rather a little night light, and they almost can focus on the little night light, and then they end up falling asleep. Light music on repeat. I have kids that wear eye masks to sort of block out, extra light. I have kids that wear earplugs because any sound, because a lot of kids with ADHD, they find that they might not even be hitting the deep stages of sleep as quickly as we think they are. They might be like light sleepers. So they almost can wake up at like but in the morning, it's like waking the dead, that they have. It's so difficult. But I was a kid where the slightest sound when I was growing up, I'd be like, what's that? I could just almost like I wasn't even sleeping. But then, especially in high school, oh my gosh, I would sleep through alarms that my brother and I, we shared a room together, he'd be like, how are you not hearing that? That's literally ringing in your eardrum. And I'd be out. And because at that point, I'm now in that stage 4 deep sleep, but it would take me hours probably to get there. As a parent, for my son, I would sing to him, and sometimes it would be like 45 minutes of me singing to him, but that's what got him to sleep. It could be other sort of sensory type things. So, a certain kind of blanket, a wedge pillow. I sleep with a wedge pillow. there's something about sleeping fully horizontally that's uncomfortable for me. I can't tell you why, but since I sleep with a wedge pillow, I sleep so much better, like sleeping almost on like an angle or an incline. So it's trying these things that might seem very odd in some way. Now, you mentioning like, your son and your husband wrestling. Absolutely. Now, I work out in the nighttime. So tonight, for example, I'll be, at the gym at 9:00 at night. Now, for a lot of people, that would totally activate them. I can tell you now, I'll have a better time sleeping tonight, having had that workout. I'll work out, I'll come home, take a shower, and I'm more likely to get to bed at a normal time than if I didn't. So it's almost like because these are not conventional brains, so to speak, some of the conventional methods might also, be different, in that way.
Super interesting. So let's go back to Waking the Dead because, we read all the articles about teenagers' sleep patterns change anyway. Like they tend to become night owls. And that's why there's so much conversation about changing school start times for high school students and things like that. Is that just the same for kids with ADHD, or does it look different, that those rhythm changes that happen for adolescents?
I would say it's the same, but it's almost exacerbated, all of that. So with ADHD, it's all of the stuff that you would typically see happen with an adolescent brain, but an additional challenge, with it, because these are even like the typical adolescent you'll find might have issues with like being a night owl, issues with sleep. But if you're someone who it's been pre-existing, it's been literally since the day you were born that you had issues with sleep, it's going to be that much more. And that is probably one of sleep and eating, these two topics are probably the most prevalent topics that parents will bring up to me about their ADHD kids. They're like, it's so difficult getting them ready in the morning and I'm pulling my hair out and I don't understand, how are they? Now, first of all, I'm a huge supporter of the late start time. My son, fortunately, is in one of those high schools where they have a late start time. I cannot imagine being at school at 7:15 or 7:30 in the morning. When I was in high school, 8:30 was when we started, and 8:45 was actually the first class. So it was 8:30 was homeroom. And that was still difficult for me. I mean, I honestly don't even remember first period of all 4 years of my high school. I mean, that's how out of it I was. I don't even think I woke up until 10 o'clock, really, like cognitively. And so there is something biological about that. And so now studies show what can help with that is if kids can have and it's hard in the morning, but even like 10 minutes of jumping jacks, running around, of any kind of physical activity, that there have been research studies that have shown that kids who engage in kind of high intensity physical activity in the morning, that can really jumpstart their frontal lobe. And that's where all of our executive functions are housed. Having a high protein breakfast, in America, we associate cereal as a typical breakfast. Honestly, most cereal is filled with sugar and really doesn't have any substantive nutrients to it. Eggs, even leftovers from dinner the night before, chicken, whatever you have, that will be a much more substantive meal from a nutritional perspective to give these kids like an extra boost of sort of starting their day. Anything like that can be really helpful. And, with even waking them up, especially like kids who you have in high school, have an alarm that's not at arm's length that they have to get up for. You might set multiple alarms. You really, especially in high school, really want to work at having them begin to sort of wake themselves up. But at the same time, understanding that they're going to need your help and they're going to need your support in doing that. But it's almost this collaborative effort of, you don't want all the responsibility to be you waking your kid up, because then when that kid goes to college, they have not learned how to actually do that. Like, these things don't just get internalized. They really have to sort of practice that.
We'll be right back after this quick break. Hey there, it's Debbie. I love making this show and sharing conversations about how to support our awesome neurodivergent kids. I've seen how even one little insight from an interview can spark a big shift in daily life. But I know that raising complex kids can be messy and lonely. And just when we think we figured it out, something comes up that boots us right back to feeling overwhelmed and stuck. That's why I've poured everything into creating a way for parents like us navigating complex parenting journeys to join together and chart a path that feels positive, hopeful, and doable. It's the brand new Differently Wired Club experience. In the club, you'll get personal support from me and other seasoned parent coaches, 6 live calls every month where you can connect and get your personal questions answered, the opportunity to learn directly from authors and experts like I have on this show, monthly themes for getting specific and tactical, an exclusive private podcast feed, and the best, most generous community of parents. Seriously, these folks show up for themselves and each other, and that right there is really everything. Because it's a daily reminder that we're not alone. Our kids aren't broken, and we have totally got this. The recently rebooted Differently Wired Club is on a brand new platform with its very own iOS and Android app. It is such a great space. However you learn, whatever your style, no matter the ages, genders, and neurodivergent profile of your children, the Differently Wired Club can help you cultivate the positive shifts you're hoping for. Join us today by going to tiltparenting.com/club. That's tiltparenting.com/club. I hope to see you on the inside.
Hey, are you a parent of a teenager? Are you feeling overwhelmed about how to be what they need while also holding limits and boundaries that keep them safe? Are you tired of conversations that negate how messy this season of parenting is? Well, I've got you. My name is Casey O'Rourke. I am a positive discipline trainer, parent coach, and the host of the Joyful Courage podcast. Every week, I come to you with an interview digging into tough topics with experts I trust and solo shows that go deep into the personal growth and mindset needed to raise teens in a way that grows them into confident, capable young people. I am not afraid of getting real about the intersection of conscious parenting and the teen years, while also bringing in vulnerability, humor, and lightness. I'm walking the path with you and honored to serve. Listen to Joyful Courage on Apple Podcasts, Spotify, or wherever you consume podcasts.
Let me ask you a question about making up sleep. So I have read that having a regular sleep schedule, going to bed at around the same time, waking up around the same time every day is important just for emotional, mental well-being, as opposed to, I know a lot of our kids on a weekend will sleep until noon or something, the older kids, to make up for sleep. What are your thoughts on that?
So this is the depressing fact, and I was not happy when I learned about this. When you lose sleep, it's gone. Like, you do not actually make up for sleep. What happens is that we're so exhausted if we haven't slept well that our body will just want more of it, but it doesn't undo the effects of that sleep deprivation. And so from a scientific perspective, we're not making up on sleep. And that's why it is important to try to wake up and go to bed. And, understandably on the weekends, no kid especially is going to want to wake up at 7:00, but they say at least within a 2-hour range. Once you get beyond a 2-hour range, so if you're typically waking up at 7 and that kid now is waking up at noon, that's really upsetting their circadian rhythms. And that's, again, even more so for kids with ADHD. So kids with ADHD, and adults for that matter, we need more of that structure and routine. And part of having ADHD is we almost rebel against wanting around structure and routine, but at the same time, we need it a lot. But yeah, we don't make up for that. And what's sad, there are a lot of studies that show just even, sleep deficits of 1 to 2 hours can have noticeable executive impact the next day. There are studies of showing sleep deprivation to be equivalent to people who are moderately drinking alcohol in terms of, driving, processing, and things like that. And knowing that kids with ADHD, or I should say anyone with ADHD as a whole, have higher rates of, car accidents and things like that, distracted driving, that now when you put sleep deprivation on that, it doesn't bode well. And so it is super important. And, I share with people, I'm a fairly healthy person, but one of the things that I do regret is how I viewed sleep. I was somebody, and a lot of people with ADHD share this, that I sort of looked at sleep as an inconvenience. I looked at it as this thing that got in the way of me doing other things or socializing with friends and having fun. And I pushed my body in ways that I really shouldn't have. And as a result, your body does very wacky things and your mind does very wacky things. Like I got shingles when I was in, my early 30s, and shingles, for young people out there who might not know what it is. I mean, that's something that like people typically in their 80s get, like it's not normal to get shingles when you're 30. But when you run your body down like that, it has such a noticeable impact on your immune system, but also just mentally in terms of our mood, our ability to regulate our mood. It affects our appetite, that there's a high correlation between sleep deprivation and obesity, because there are hormones that are happening in the body that actually program it to conserve body fat and plummet our metabolism when we're sleep deprived. So there's so many implications of it that I think a lot of, especially young people, don't really appreciate. And I was one of those young people that didn't really appreciate it. It's only when I got older and it started to hit me in a different way that I thought, oh, I guess I should really work at this. So I think it should be a conversation to just, even when your kid is young and, in language that they understand, to start to sort of prep like how important sleep is, not just because it's one of those like, oh, sleep is important because it is. It's, like sharing with them that, when you sleep, it actually, your brain is doing a lot of activity in terms of making you stronger, making you think better the next day. Like we think of sleep as a passive process. There's a lot of activity happening when we're sleeping.
So how about for listeners whose kids are on ADHD medication? I don't have personal experience with this, but I have heard that that can also sometimes affect, or maybe you tell me, like, is there a correlation between ADHD meds and trouble going to sleep, or what is the relationship there?
Yes. So the class of medications for ADHD are the stimulant medications, things like Concerta and methylphenidates, the Adderall, amphetamine salts. And it's interesting that, so yes, there are some people who, if they take a dose of their medication later in the day, it will affect and impact their sleep and keep them up for a long period of time. However, I have many patients actually who will take a dose of their medication sometimes within a 4-hour window before they go to sleep, and it actually helps them go to sleep because it's properly focusing them on going to sleep, meaning they're not going to be distracted by all those other thoughts that might be circulating in their head. They're better able to feel grounded and in their body in that way. So again, it's trial and error that each individual with ADHD presents differently, that there's this commonality that we all have and share. And when you're talking to someone with ADHD, there are going to be those moments. It's like, oh man, that's exactly like me. Oh, I totally understand. And then there are going to be things that are wildly different. I have an older brother. He has ADHD. Our ADHD manifests in very different. He's more the inattentive type. I'm definitely more the hyperactive type. And so as a result, that presents, there are commonalities and then there are differences. And so I would say with parents, whose children are taking medication, and this could be frustrating, but it's worth going through this process, is almost preparing for a little trial and error. And that might mean sometimes trying 4 different medications. Because again, somebody could take one medication and it keeps them up all night, and they could take another one in the same family. Like they could take another medication in the same methylphenidate family, let's say, and it does something different. And that's what's interesting, is that it's not as sort of predictable in some ways as some other classes of medications like the SSRIs, which are antidepressants, because the stimulant is working in context of that particular person. So to give you another example, like if somebody has ADHD and anxiety, so 30% of people with ADHD have anxiety. Sometimes stimulant medication makes their anxiety worse because they're focusing more on the thing that's making them anxious. And a lot of people, the stimulant helps their anxiety because they're better able to properly focus on what they want to be focusing on and moving away from the anxiety. But there's no prediction as to which people will be in what group. So there are people I work with ADHD and obsessive compulsive disorder who cannot be on a stimulant. And then there are some that the stimulant is a very important part of actually helping, even though the stimulant is not a treatment per se for their OCD, but if their executive function and their lives are in place and there isn't a lot of chaos, their OCD doesn't get triggered. And so the same as with sleep is you have to sort of try it out, but don't throw out the idea of all medications because one of them doesn't work. It really, they're so nuanced, these medications, even though they're in similar families, that it could be worth it.
Great. Thank you for that. That's super helpful. So let me just ask one more question. And that is for parents who are listening, who are in this predicament and their child is really struggling with sleep and they don't know where to start. Do you have strategies or maybe some favorite resources, or what should their first step be to try to get things back on track or help their child?
Yeah, I would say really just, trying to get an assessment of what the issue is. Are they having an issue with almost properly grounding themselves to like go to sleep? Are they worried, that they're going to wake up in the middle of the night, or maybe they will wake up in the middle of the night and they're worried about how to then soothe themselves back to sleep, trying to get a sense of that, and also working with your child around bedtime hours. Now, this is something also I would say more for high school students that sometimes, and I would agree with this, that, with a high school student, sometimes there's this window. If they go to bed too early, then they're not almost tired enough, and then they're thinking, and then they're up all night. So sometimes it's actually helpful for them to go to bed like maybe a half hour, 45 minutes, maybe even sometimes an hour later, but then they're much more tired and able to fall asleep, and then they get a more solid level of sleep. So it's almost I would keep a log basically of like how many hours are they sleeping, what's helping them fall asleep, what's getting, in the way. Certainly talking, with their pediatrician or a therapist that has experience with ADHD to try to, understand and really work collaboratively with the child. Because a lot of times, especially when children are young, if they have trouble falling asleep, they might just come into your room and want to sleep with you. And initially that's going to be fine. And there are some nights, but what I've seen a lot is that can become then a habit where the kid is not learning their own way of soothing themselves, because part of it is what we're trying to do is help them remain in bed, even though their brain might be kind of bored. And their brain is now going to look for something to stimulate, and they have a hard time soothing from that. What are tools that we can give them, and helping kids have like a toolkit? Maybe they have a teddy bear that they sleep with. Maybe there's something sensory that they can touch, or a certain blanket that helps them, adjusting the temperature in their room and saying, okay, let's work together to figure out how we can help you sleep. Also keep in mind and be watchful. If you have a child that snores like loud, like to the point where you can hear them in the next wall, please talk to your pediatrician about a sleep study. I have very severe sleep apnea. And I was a snorer my whole life. And I was this short, skinny kid, when I was very young, and my brother would be horrified by the noise that came out of me. And it wasn't until I had a patient who had sleep apnea and ADD that I researched sleep apnea. And I thought, I can relate to a lot of these symptoms. Had a sleep study, and basically you need 20 events in an hour to be diagnosed where you're either not breathing or your oxygen levels are super low. And I had 98 events in an hour.
Gosh. Wow.
And it turned out I had a deviated septum in my nose, which was only allowing for 30% oxygen to go through my nostrils. And my throat basically is anatomically, such a way where my tonsils are enlarged, and it's so crowded that I was getting almost nothing through my throat. So the doctor said it was literally like me breathing through a straw under the ocean, like trying to get oxygen. So, and it could be very harmful for your health. Luckily, I caught it early where, my heart's fine and everything. But with kids, sometimes they do a tonsillectomy, and that could help. Sometimes it's a septoplasty where they clear out that deviated septum. Sometimes it could be related to weight. Sometimes it's anatomical, sometimes it's weight related. But definitely just be aware of that, because that's something that even though your kid might look like they're sleeping, if they're snoring that loudly, they may never be entering those deep levels of sleep, which then can explain why they have a hard time waking up, and it can absolutely exacerbate their ADHD symptoms. And in some cases, I've done consultations where kids did not have ADHD. They actually had severe sleep apnea. And then in a lot of the cases, it's both. I think, again, you'll see a higher rate of sleep apnea and these sleep disorders in kids with ADHD.
Wow, so helpful. You've shared so many great words of wisdom and insights and just information. So thank you so much for all of that. And is there a place for listeners to connect with you, or are you on social media, or where do you suggest people go?
So I'm sort of in the dark ages where I don't have any social media. And I don't even have a website, but I do welcome, I have good old fashioned email. My email address is Roberto, Roberto _Olivardia, which is OLIV as in Victor, ARD as in Daniel, IA, at HMS as in Harry, Mary, Sally, .harvard.edu. And honestly, any parents out there, I welcome, any questions, and I will definitely get back to everybody.
Thank you so much. Listeners, I'll have Roberto's email on the show notes page if you want to check that out. And wow. Okay. And yeah, I actually just did an episode recently about body positivity and differently wired kids, but I'll definitely want to circle back to talk more about your work regarding food and boys and kids. So thank you for that. And thank you again just for everything you shared today. I really appreciate all the time you took with us.
Absolutely. It's my pleasure.
You've been listening to the Tilt Parenting Podcast. For the show notes for this episode, visit tiltparenting.com/podcast and search for this conversation. If you like what you heard on today's episode, I would be grateful if you could take a minute to head over to Apple Podcasts and leave a rating or a review. Thank you so much for helping us stay visible so people who would benefit from the show can easily find it. If you want to support the show and help me cover the cost of production, please consider joining my Patreon campaign. To support the show, just visit patreon.com/tiltparenting. Lastly, if you aren't already part of the online community at Tilt, I invite you to sign up at tiltparenting.com on the box in the bottom where it says Join the Revolution. Every Thursday, I send out a short email with a quick note from me, a link to that week's podcast episode, and links to 5 stories from the news that week that are relevant to parents like us. Again, you can sign up and learn more about Tilt at www.tiltparenting.com.
If you're a parent, I invite you to join us at the Mindful Mama podcast, where it's all about becoming a less irritable, more joyful parent. With sometimes hilarious and always thought-provoking experts and friends, at Mindful Mama, we know that you cannot give what you do not have. And when you have calm and peace within, then you can give it to your children. I'm Hunter Clark Fields, and I can't wait to see you there. Listen in to the Mindful Mama podcast.